So this is basically anything you need to tie knots, nothing too fancy. There's also Ethicon boards, but just taped some string down here. This bundle of string or rope I'll leave in the GYN call room. Suture removal kit, some silk free ties, a marking pin if you're really obsessed about having purple string, and some tape. All this stuff can be obtained in the OR for relatively cheap. So when you're setting yourself up to tie two-handed ties, I'm going to try to tie behind the camera, but you always start with your strings crossed, and then you're going to hold each string in the other three fingers. And if I'm passing the suture with the left hand, you either push it over with the index finger, or you can push it under with the thumb. This would be left-handed two-handed ties. If I'm doing right-handed two-handed ties, it's the same thing. I would use the thumb to push it under the left-handed string, or use the index finger to push it over the left-handed suture. So it's important to know that there are two different types of right-handed ties. There's the right-handed and the left-handed two-handed tie. So imagine that I'm right-handed. So needle drivers here, tissue forceps are here. If I pass this under, I pick it up here. This side can no longer be the tying side. So, I mean, this side is no longer the free end. So free end's in my left hand, so I have to learn to tie right-handed two-handed ties. So I put the needle down, or you can actually hold it in your hand and do the same thing. But for simplicity purposes, we'll put it down. So now, to tie right-handed one-handed ties, if you're right-handed, and then you want to tie left-handed one-handed ties if you're left-handed. Alright, but you gotta learn both hands, because sometimes the attending will ask you to tie the angle for them, and then you'll be backwards, and you have to learn to tie a left-handed two-handed tie. So for demonstration purposes, we'll start with the right-handed two-handed tie. So to do a right-handed two-handed tie, pick up the string the same way. Three fingers here to hold the string, and these will pass the sutures above and below. So starting with the right-handed two-handed tie, you can see that the strand is already crossing over above to start with. So you start with the index finger, like a C. You're going to take this and you're going to push it over the other strand. Okay? Now you have a loop that you need to pass the other suture through. So you're going to take your index finger and your thumb finger, or your thumb, and you push it together. You can come to the other side of the loop you just created. You want to grab the free end. Remember, the free end will always be in your left hand, because the needle driver, in theory, is on your right hand. And just cinch it down. Okay? So the first one we did was a four-finger pass over the top. So now we've got to use sorry, index finger pass over the top. Now we're going to use our thumb, pass over the bottom. Same principle. Take your thumb, you pass it under instead of over this time. Make a closed circle with your fingers. This allows your index finger to get through the loop. And then you put this free strand, which is in your left hand again, between your index finger and your thumb. You're going to push it through. And then this is important, because you're going to have to learn to cross your hands to properly tie square knots. Now, when you're set up here again, you can see the top strand is already crossing over. So it helps remind you that you need to go above it, which is your index finger. So you'll take your index finger, put behind it here, you'll go across, make a loop, close the circle with your thumb, come to the other side, and then pick up the free end and pass it back under. And that will be your square knot. You can continue this. I just did a index finger throw, so I'm going to do a thumb throw. So thumb under, cross, close the circle, come to the other side, grab the free end, push it through, and tie it down. Okay? And then you're already set up to come across here, because your index finger is going to go over. You're going to close the circle, come to the other side, grab it, and come back down. And all of these will lay flat, stay square, and your strands will always be perpendicular to the suture line. So let me show you how to do one-handed knots in the next video.